Hey everyone, it's me, Dr. Cooper Lovett, or Dr. Coop Love. This is for my colleagues. I hope y'all doing good out there, taking care of yourselves, self-care, being healthy, because I know we still have our job of seeing people and seeing clients, even though I'm aware that some of us may have lost clients, including myself temporarily, because these are the clients that prefer to have been seen in person. But at the end of the day, I say safety and health is number one. So as a result of that, I'm always respectful and understanding of people's preferences as it relates to being seen in person versus the office. And at the same time, I do caution them and tell them that this is until further notice, because we really don't know exactly when they can be seen in person again, for the sake of safety. And I understand some therapists still may be seeing clients in person with being very cautious and aware of what's going on. But for those of us who are making the decision to go full-time online during this period, I just felt it was useful to give some tips or some pointers of what could be beneficial and helpful. I understand, we all have different experiences. We all have different family contexts. Some of us have children. Even though I'm with child, he's not out yet. So it's a little different for me than it is perhaps for someone who has children or who even has a pet. I'm a fur mama to a Yorkie. So he likes to bark a lot for some reason when I start these sessions. And that's one of those things where it's like sometimes I have to, before I even start, put him in his little cage just to get him to relax, because it can be a distraction. So, just some pointers with starting first and foremost. I know HIPAA has created some form of leniency with regard to HIPAA, such as doing FaceTimes and things of that nature. But I always like to proceed on the line of caution. So some of those platforms, which I know other therapists have also mentioned and posted things about what's beneficial for therapists to do with regard to telehealth or video sessions, is some Simple Practice has theirs. I think they're doing a 30-day free trial for that. Doxy.me, that's another platform. Zoom is another platform, and VC as well. I'm sure there are plenty others, but those are the main ones that have been circling around at this point in time. And so I've always, particularly careful with these things, and with Zoom in particular. You can lock meetings and things like that. That's the one that I use right now. So, and it's been helpful and beneficial for me. I've been doing the telehealth half of the time in my practice since December, since I got further along my pregnancy. It was just becoming too exhausting to sit in the office all day. So my plan was to say, hey, well, let me try half of the day online, which I found to be very beneficial, particularly for my evening clients. And, you still do the same thing, look presentable, because there's times, actually on Friday, I was like, oh God, because my mind has been all over the place, that I had a session that I had scheduled, but I realized I accidentally put her in the wrong time slot. So I had to get myself together, and look presentable, because I like for my clients, even though we can't see each other face to face, I like for them to see me and I like to see them, so we can engage to the best of our ability given this situation. Also I do most, if not all of my sessions on my laptop. Some people can do it through the phone, or they can do it through how I'm doing it now, with a tripod to keep your phone on, so you can continue in the session without interruptions or having to hold the phone up in the air or things like that. But just something that's steady, keeping your phone charged, keeping your laptop charged, because there's times my laptop, not recently, but has died on me unexpectedly, and to also prepare for glitches, because there's some glitches sometimes. Some of our clients aren't necessarily technologically savvy as well when it comes to some of these things. So it's just being patient. I try to send out the link a couple of days before their session, so they can download it and kind of play around with it to get an idea of how it works. And I would say that would be with any platform, if you can do that, because some people may, like I said, struggle with figuring out how to make it work. But it's just preparing for those glitches, you know what I mean? And show up, and definitely be just as engaged as you were if you were in office. Like I said, it's a completely different thing. I can't shake your hand and all that stuff like we usually do. But a lot of my first time clients, especially as of lately, have been through video sessions. And so it just give them a chance they already know me to some degree because they research me, but a chance to get to know each other. I kind of go about it the same exact way that I do when we're in the office, except we're not in person. Have your AirPods. I have my AirPods or earphones, have those already ready. Just kind of have your station situated to the best of your ability. Try to minimize distractions as much as you can. You know what I mean? Because me and my husband are both here. So, he's usually on one part of the room, I'm in another part of the room or the house, so that, because he's also working from home. So we have to kind of figure out ways to maneuver. But like I said, with my fur baby, he likes to bark. So I have to maneuver that in advance. So if he gets out of hand, I have to excuse myself and apologize, So it's all these factors. Also in regard to giving yourself breaks, I'm the queen of doing back to back. I still kill myself. Tomorrow I got 7 appointments. I gave myself an hour break though, but I'm going to enjoy that hour break to eat or decompress and do what I need to do. And sometimes, what I find is that even scheduling out, which is what I need to do, I'm giving a dose of my own medicine. But even if you schedule out, like if you got 1, 2, 3, and then break 4, 5, 6, 7, maybe have it 1:15 and, give yourself about 10 minutes in between. That's why I got to figure out how to implement that into my system as well. Because a lot of times, by the time you're into one session, that other session is already there waiting for you. And that's the thing I like, particularly with Zoom. They'll tell you that you're meeting, the party is ready to meet with you. So you know that they're there when you're going. Keep your stuff, like I said earlier, fully charged. AirPods in particular, because sometimes those will give out on you. I just keep saying be prepared for technological issues, as well as, like I said, just keeping things copacetic to the best of your ability. And, if they have any issues or concerns, to be sure to address that, with regards to that, because I know I had, some people who were concerned about, emails and things of that nature that would be associated with them going to therapy, because I know some people are still very private about that, and it's reassuring them and sharing with them, like, your things are confidential. What email would you prefer me use? Would you prefer me have an email? What method of contact, but would you prefer? But that is I use Simple Practice as my engine, and so it kind of asks all those questions beforehand anyway, but I do in this context like to readdress those things. So those are also some things to think about as well. But those are the things at this point that comes to mind. If you do have any questions, as therapists, especially those of you who are still trying to figure things out, I'm available and open to responding to any questions you may have, because I know right now, this is our way of staying safe. And at the same time, I understand that we all operate a business and we have families, and that the people that we serve have families as well, and that we're all impacted by this whole entire thing, and so what I want for you all to do is to be safe, be healthy, take care of yourselves, especially us as therapists. Make sure we meditate, center ourselves so that we can be our best selves, so that we can serve others during this difficult time. I hope everyone has a wonderful and blessed day, and take care.